welcome to Inside Healthcare. We have a great program for you. A local doctor is joining us to tell you what you need to know about the #1 killer of women, and that's heart disease. We will also hear how young people can get help finding high-paying, high-demand healthcare jobs. And later in the program, the latest in fighting diabetes with a high-tech solution developed right here in Minnesota. But we begin with what you need to know about women and heart disease. And joining us, we're pleased to have back with us Dr. Carolyn McLean with the Urgency Room. Thank you for being with us again.
Thanks for having me.
It's always a pleasure to have you here.
Thanks.
So we thought with February being Heart Month that it might be a good time to kind of just review, bring awareness to heart disease in women. I think even in today, women may still be, and men, surprised that it's still the #1 killer of women, kills more women than all the cancers combined. What do people need to know about heart disease, especially women?
So I think you make a good point in that the healthcare community has done a really good job of getting the word out with cancer, and we have breast health, but our heart disease kills one out of every 2.6 women, and breast cancer kills 1 of every 30. So heart disease is still the leading killer of women, and women don't think about it like that. So I think we think about it as we worry about cancer, we take care of ourselves, but heart disease is something that's not at the forefront, and we don't expect to have a heart attack. So I think that's one of the big reasons why women don't come in and get checked out as frequently as men do.
But this is something that you see in the urgency room all the time.
Yeah.
Unfortunately.
Yeah. So one thing with heart disease, when you're having a heart attack, it doesn't feel like you expect it to. So people, when you see it on TV, someone's clutching their chest and they're having a hard time breathing. But heart attacks are more subtle than that. So what happens is, with women, women will have nausea. They'll just feel sick.
Nausea. How do you tell that's a heart attack, not just the flu coming on or something?
Right, so that's a good point. So one of the ways you can find that out is if you are having nausea or pressure in your chest or difficulty breathing, doing things that you normally have no problem doing. For example, walking up the steps. If you're walking up the steps and you're getting short of breath, and that's something you do every day, that needs to be checked out. And you need to come into an urgency room or an ER and have your heart evaluated.
And I understand that men and women tend to have different symptoms as well.
So yes, women tend to have more nausea, but in general, I think women just don't recognize it for what it is. But most of the time, people expect pain, and it's really a pressure on your chest. And it can go down either your left arm or your right arm. It doesn't always have to be your left side. It can go into your jaw. Women will just have jaw pain going up the steps, and that's an unusual symptom. And even sometimes they'll have neck pain and think that they pulled something in their neck. So
again, how do you tell the difference?
You really need to think about if it happens when you're walking or exerting yourself and not just when you're sitting still.
Or shoveling snow.
Shoveling snow is... Shoveling snow, if you get any neck pain while shoveling snow or difficulty breathing or any pressure on your chest while shoveling snow, absolutely come right in.
And are there certain populations that are at a higher risk for it, among women in particular, for heart disease?
So it's really important that you go see your physician so you know your risk factors. The biggest risk factors are high blood pressure and high cholesterol. But diet and exercise are critical to preventing heart disease.
That's what I was going to ask you next, is what are things that we can do to prevent developing heart disease in the first place?
Yeah, so there was a great study that came out of Health Partners, and what they did was if your cardiologist did everything perfect and managed all of your risk factors perfectly, they could only make a small dent in what you can do for yourself. If you have a healthy diet and you exercise, that's most of the battle.
And if you have a family history, that's important to know as well, because then you have a much higher risk in general than the general population.
Absolutely.
Go ahead.
Women will also present with heart disease slightly later than men, but having a family history of male heart disease in your family still counts as a woman. It's just that you tend to present later in life, maybe 5 to 10 years later.
And if you had a mother or father who had heart disease at a younger age too, I think that would also signify.
Absolutely, absolutely. So the main thing for women to do is to go in to see their physician, evaluate their risk factors, and there's a lot you can do for yourself to prevent this from happening to you.
And that means just getting up and moving, if nothing else. You
Exercise as much as you can, yeah. And that doesn't have to be really rigorous. You don't have to run a marathon. Just park farther out in the parking lot. You know, take a walk. Do as much movement as you can during the day.
Other things that our women should be aware of in their risk for heart disease?
I think the most important thing is awareness. Just knowing that if you have these symptoms, you need to come in and be checked out. So what we found is that women in general get less care for heart problems. And I think that's because women don't recognize that they have them. So if you are having any shortness of breath, nausea, chest pressure, you need to be evaluated.
And probably call 911 even if it's...
Absolutely.
Don't wait or drive yourself to the hospital.
No, don't drive yourself. I always worry when people drove themselves in and they're having a heart attack. I think, oh. But yeah, absolutely. It is completely reasonable. Sometimes people feel guilty about calling 911, but if you're having chest pressure, you should call 911.
Because you get the help right away in the ambulance
right away.
Before you even get to the urgency room or the hospital.
Exactly, and they can do an EKG right there when they get to your home. And so they can act, for example, if you are having a heart attack, they can call ahead and let us know, and we can get you care faster.
Wow, great advice. And then the urgency room, just for our viewers who aren't familiar with it, where is it and what is it and how is it different than an emergency department?
So we're essentially a freestanding emergency department, and we take care of everything from broken bones to heart attacks. And we are in Vadnais Heights, Woodbury, and Eagan. And we're open from 8 a.m. to 10 p.m. at night and every day of the year.
Sounds great.
Thank you.
And just final comments for our viewers, final advice.
Yeah, so
Come see you.
Yeah, well, I think it's just important to remember that women have heart disease as well as men, and that you really need to be aware of your risk factors. And if you have chest pressure, you need to come in to an emergency department or the urgency room.
Well, great advice.
Thanks.
Thank you. And as always, it's a pleasure to have you with us. So thank you, Dr. McLean.
You're welcome. Thanks.
Well, still ahead, help for young people and finding high-paying healthcare jobs. Stay with us.
You're doing great. We're gonna try this again, okay?
Okay.
Wheels, pedals, handlebar, brakes. Sit up straight, keep your weight in the center, keep your eyes on the road, hands on the grips, button to seat. If we feel ourselves falling, what do?
Just keep pedaling.
Good girl. Now remember, it's all about balance and steering. Steer with your hands, steer with your body. Steer into the corners and you stay out of trouble. And the bell's your buddy, so go ahead and ding that. All right, you ready? Here we go. Pedal, honey, pedal. There you go, you're a bike rider.
Most parenting is hard to do in just 2 minutes. But 2 minutes twice a day making sure they brush is easier, and it could help save them from a lifetime of tooth pain.
Welcome back to Inside Healthcare. Did you know that your local workforce center can help you find high-paying, high-demand jobs such as those in healthcare? Take a look at this video.
We're a growing county, so we're rapidly growing.
I need young people out of high school.
Pay is great, benefits are great. The pay is really good, especially for not having any college experience.
The Workforce Center and its youth program gives them an opportunity to just kind of start over again.
And at the end of the summer, they can earn over $1,000.
Being able to be a part of the youth program opened a door of opportunity for me. I am employed at Washington County as Office Support 2, and I was once a part of the youth program at Washington County. I had no direction after graduating early from high school, and the youth program was there for me, and it was a foundation in selecting a career field, selecting a school, and the necessary steps to get into college.
If you are out of school, for whatever the reason may be, there's always an opportunity here for us to give you some guidance and can help you kind of chart your new pathway. They can earn high school credits. They can get their GED if they don't have one. And they can also enroll in college, and we'll help assist them with support services while they're in college and help pay for some of their tuition.
The youth program is awesome. I would take advantage of it.
They actually introduced me to the CNA program, so I wasn't aware that there was a program like that, but they did tell me about that. And they helped me with the cost and expense for the CNA program and the books. I didn't want to go the whole summer break, so I just picked the 2 weeks. And it was interesting. It was very fast. I am thrilled to be coming in CNA, well, to actually be forcing that.
We're almost a 40-year-old local nonprofit dedicated to improving lives and landscapes. This year the kids put in the bridges. They're just wonderful.
It's an opportunity for youth to go out and improve the environment and at the same time earn a paycheck.
It's not the same person at the end of the journey as the one that started the journey. It's much, much better.
In the end, they've done this nice project that's going to be there for years. They've amazed themselves, they amazed their parents, they amazed the city. It's an amazement piece.
We are getting more employers that are moving here and starting new businesses here. Washington County has a lot more business opportunities to offer now to residents.
Mostly it's new CNC computer-controlled equipment. I need young people out of high school, out of one-year degree, out of two-year degree programs to work for us in the machine shop trades. You would start at probably $35,000 a year. My manufacturing engineers make between $60,000 and $90,000 a year, and they've all got two-year degrees. So it's just a good field.
I'm only 20 years old, graduated from high school 2 years ago, and I'm making more than anybody I know.
I'm super grateful for that opportunity because it has resonated and it still helps me today.
I really do recommend it to other people, not just my friends, but everybody else who needs it. They can really do much for you, a lot.
For me, I'm so passionate about helping people, and this I can see we make a difference. So we make a difference in their life. That's what the Workforce Center is really all about.
And joining us now is Robert Crawford that you just saw in the video. He's with the Washington County Workforce Center. So thank you for being with us.
Thank you for having me.
So how does the Workforce Center help people of all ages seek new jobs, get jobs?
Well, we have 3 workforce centers located in Washington County, one in Forest Lake, Cottage Grove, and our main one is in Woodbury. So what we offer is services for anyone who's unemployed or underemployed and really looking to either find a good job in any of the healthcare industries or manufacturing and the financial sectors. There's so many jobs out there right now. So what we do, we offer different kinds of workshops to assess their skills and their abilities and help them with career exploration. So
because people don't know which way they're going to go or what they want to do or what they're good at.
Yes, so we offer a career exploration workshop, and that's where they can find out what their interest skills are, and then we can help direct them with a person or a case manager to kind of direct them in the right sector that they can find a really good job.
And this is free services to anyone in the county?
Absolutely.
And
yes.
other counties also have workforce centers as well?
Yes. There are 48 throughout the state of Minnesota, and all of the workforce centers offer similar services. It depends on the locale. Some like the services that we offer, we have all of the what they call the Minnesota Family Investment Program, which are people who are receiving public assistance, and they're required to look for work. So we provide that service for Washington County. And there are also other programs that we offer, like the Dislocated Worker Program, which people get laid off from their job for no fault of their own. And then the youth program that you saw in the video, we offer services for youth between the ages of 14 and 24. And there's all kinds of services. We're almost like the best kept secret in the county. There's so many things that we were involved in. But if you're looking for a job and you really don't have any self-confidence or any self-esteem, the Workforce Center can help you build those. And
that's interesting, because you're saying that lack of confidence or self-esteem is a huge issue for people out of work and looking for work. And
absolutely. One of the things that we find is that most people get laid off from their job. They lose their self-esteem because if they have the sense that they're hopeless. And a lot of times when they come to our workshops, that's the one motivator to help build those skills and get people to thinking that they can do anything. And once they get that self-esteem back and that confidence, they can do anything. And then they end up generally finding good paying jobs in the area that they are interested in.
Now, we saw in the video how the program helped one particular young lady get into the certified nursing program, I think is what it's called. And how did the Workforce Center specifically help her, and how can it help other young adults?
Well, she was really interested in the healthcare industry. So usually when you get involved with us, we assign you a counselor, and that person works with you to figure out what your aptitudes are and your skill level and your interests. She was interested in the healthcare industry, so she was directed, and once the assessments were done, got her involved in the CNA program. And then what we do, we pay the tuition and the books, and we also buy the uniforms for her while she's participating in that program. Her real interest is to become a dental hygienist. So she's still going to school part-time, and she's going and working at the same time. So our job is to support her during that process, and that's what we've been doing, and hopefully she'll get through this whole process and become a dental assistant, because she really is motivated, and I think that's part of what the whole process is about, is trying to keep them motivated and focused and give them the support that they need. If they need a car repair, sometimes if their car breaks down, we're there to help provide those services as well.
And it seemed like, too, she wasn't even aware there was such a program, and then the course that she took to get that initial certificate, just 2 weeks, a fast-track program?
Yes.
Wow.
Yes, we've been working with one of our local colleges with a fast track. It's called Career Pathways, and the person get involved. And then we have also one of our local adult basic ed programs to work with us. So an individual who really needs to build their skills, who, if they had not gotten a high school diploma, they can work through this process to get that. And that's kind of the beauty of the system, that if you come in and you don't know, have any idea how to get to where you want to be, the Workforce Center can help provide that direction for you.
And then just briefly on the high demand jobs, high paying jobs, don't necessarily require a 4-year degree. What are some of those areas that are in high demand? And
a lot of the high demand jobs now, a lot of them are in the healthcare industry, and we're focused on a lot of those, but we also have a lot of advanced manufacturing. A lot of these manufacturing companies can't find enough skilled people in the to do machining, CNC, welding, all those occupations right now are in high demand, and they're really good paying jobs. And that's what we try to direct people. We want folks to get jobs that's going to help get them off the system and be contributing adults in society. And so that's just a few of the jobs. We have companies coming into our offices weekly who are looking for people. It's just the unemployment rate right now is less than 3% in the metropolitan area. So it's like employers now fighting to find the good people. So right now it's the market for people who are unemployed and really looking to build their skills. They can get a job pretty much anywhere they want.
So if they want to get in contact with Workforce Center, Washington County, how do they go about doing that? They
can call our office at 651-275-8651. That's our main number, and someone will be there, a person, to answer your call. It won't be a recording. Or you can just walk into any of our offices, the one in Woodbury, 2150 Radio Drive, and then we have in our service center up in Cottage Grove, and the one in Forest Lake. Just walk in. The one in Forest Lake is connected to the library, so a lot of people know where the library is. So just walk in there and tell them you're interested in finding a Workforce Center, and they'll direct you back to where our offices are, and we'll be more than happy to help you.
Well, Robert Crawford with the Workforce Center, glad to have you with us. So thank you so much. Great information.
You're very welcome. Glad to be here.
Thank you. And still ahead, new technology that could make it easier than ever to fight diabetes. Stay with us.
I know what it's like to grow up in a world that looks at you very differently. Every day, many children with physical imperfections and deformities courageously face the world. Together with the Caring for Kids program from the Plastic Surgery Foundation and the Hannah Storm Foundation, there is hope. With your help, these children can get the medical procedures they need, regardless of their ability to pay. Help a child in need at thepsf.org/kids.
Now we turn our attention to the new high-tech solution to fighting diabetes developed right here in Minnesota. And to tell us all about it, we're very pleased to have with us Lonnie Stormo, the CEO of POPS. Glad to have you here.
Thank you very much for having us.
Before we have you talk about POPS, I understand that this is something that's very personal, diabetes to you. Why don't you tell us a little bit about your personal story?
Yeah, I'm kind of an odd case. I don't have a long family history of diabetes, and I didn't get diabetes when I was a child. I got it kind of midlife in my 30s. Very active person, and actually my first symptoms were I would get cramps after I would go running. Didn't understand what it was, kind of ignored it, as a lot of people do, ignore first symptoms, and it wasn't until my vision started getting blurry that I actually ended up finding out, going to the emergency room and finding out that I had diabetes, which was quite a shock for me, as you can imagine.
And how did that lead to developing POPS?
Yep. So as I was managing my diabetes, and I would test my blood sugar with a test kit similar like this 5 times a day on an average, and I mentioned I run. One of the things that was always frustrating to me when I was running is it's not very easy to carry this around when I'm running. And so I just felt like as I was managing my own condition, that there was a better way. There needed to be a better way for diabetics to kind of self-manage, which is one of the, this is one of the conditions where self-management's a key.
It really is. I mean, you have to keep those blood sugars level. You can't have the highs and the lows, which is very common.
Right.
To control that.
I try to manage, within a range of, 70 to about 200 at the most, because if you go lower than that, you start to have, immediate conditions like sweating, fainting, etc. If you get higher than that, that's when you start to have all the complications that come from diabetes.
So what is POPS and how does it work?
Right. So POPS Diabetes Care is really creating a new care model for diabetics. Today, when I talk about the complications from diabetes, most people don't know that 3/4 of the cost of diabetes are actually because of the complications. So people aren't doing very well with the current care model because this kit is inconvenient, it's painful, you can't do much with it once you see the result. And so what we really have is a solution that engages and empowers the patient using the power of our phones, using the power of the mobile platform.
Yeah.
And everybody has a phone today, right? So really our solution is 2 things. It's one, a small module on the back of the phone that makes testing now as easy as carrying your phone.
Wow, you've barely noticed
and it uses the power of the phone to basically create that engagement and self-care.
And there isn't anything like this on the market currently?
There is nothing on the market like this currently. Almost all diabetics are testing with a kit similar to this. They lovingly call it their shaving kit or their zip-up case, things like that.
So how does it work?
So now when I test, as I mentioned, I can simply just pull up my app. I touch one of the test sites on here, and then it engages with the meter, and I lance myself that simply. I put blood on the test strip, and I get a result on the phone. So that's simply how it works. So it's a much easier system, something that's with you all the time because you're carrying it. And as you saw, I could test right here just very simply, and I don't have to assemble a test kit and unzip it on the table. And for instance, if I'm at work, become the center of attention that now I have diabetes. Now I can walk down the hallway at work and see that I don't have diabetes.
And there's other components to this care as well as just
right. So once you
blood
get the
sugars.
number on your phone, now you can start to use the power of the phone. And really what we want to do is create a virtual healthcare professional interaction with the patient every day. So your phone can start to do intelligent things like ask you questions, prompt you to do certain things, text you, reward you, educate you. And so now the patient becomes much more engaged in their diabetic care instead of just testing and having a number and reacting to that number.
And the future would also be interacting with maybe with your doctor in the clinic as well?
Exactly. So for the patients who need that additional care, you also have the connectivity of the phone. And so as I just tested my blood sugar, I have this set up. I enabled the text. So my wife just got a text that said Lonnie tested his blood sugar and it was 115. In addition to that, there's a connectivity. If I want to give my healthcare professional access to this information, now they have a dashboard of all their patients that are managing with this system, and they can see on a real-time basis who's struggling and who needs a reach out and some additional help beyond what the phone can give them.
And is it available yet to the public?
Right, it's not available to the public. We're still developing the system, and we have to go through FDA approval. We now have a working system, as I just demonstrated for you, and as I'm using on a regular basis in a non-FDA approved manner. But we're basically getting patient feedback so that we can go out and make the best system and get that FDA approved.
So if someone wants more information about it, how they go about doing that?
Right, so popsdiabetescare.com is the best place to go and see what we're doing. You can also send us a message through that website, and you can also follow us on Instagram at popdiabetes.
Well, we'll have to have you come back when you get that FDA approval and tell us where things are and how people can get more information about it.
We would love to do that.
All right, thanks, Lonnie.
Thanks for having us.
Great invention there.
Thank you. We're excited about it and excited about giving diabetes a new chance.
Sounds great. Well, that's our show for you. Thank you for joining us. We will see you back here next month on Inside Healthcare. See you then, everyone. Thanks, Lonnie.